I'm Dr. Pete Hilgartner, and I practice in Leesburg, Virginia. I started doing ABC. I went to my first seminar in 1999. The way I met Jesse is I was actually practicing a whole different technique, and I had seen at the time he was just sending out faxes, and I saw this, fax about, correct bodies get these results every time, blah, blah, blah. And I kept going, yeah, right, it's another marketing thing. And finally one day I kept getting these faxes, and I said, I'm going to call this guy. So I called him up, and he has me do the first rib maneuver over the phone. And he goes through this whole thing: breathe in, breathe out, let your body go, squat down, stand up. How's your body feel? Okay, do the first rib, do the exact same thing. I'm like, whoa, I can breathe differently. And at the time I was having problems with my left knee, and I bent down and came back up, and I was like, oh, my left knee doesn't hurt as much. And he goes, well, how do you feel? And I said, that's a lot better. And he goes, okay, what's your credit card number? And that was it. And so I said, well, wait a minute, hold on. I want to understand what we're doing here. Well, a couple of months later, there was a big convention in DC of all the biggest chiropractic technique gurus that were supposed to be presenting their techniques. And the intention, I think, was to find the unifying system of chiropractic. Anyway, I was asked to go present for the technique I was using, and I met Jesse there. And so we talked a little bit, and he gave me the first adjustment, ABC adjustment. The next morning was the first time that I woke up in probably about 25 years without back pain. I started having back pain. I was a rower in high school and in college. Had my first episode of real severe back pain, debilitating back pain, when I was 16. And even though I was competing at a high level, I was a collegiate rower, I was a national team contender, and every day I had back pain. I'd go through a series of stretches and exercises and things for about 40 minutes every day, just to get moving. And again, after that first ABC adjustment, it was the first time in that many years that I had gotten out of bed that I was like, whoa, my back feels good. I don't feel like I have to do any of that. So I called him up and I said, okay, where's the next seminar? It was up in Philadelphia. I went to that, and that's how it started. At first, it's such a paradigm shift that I couldn't let go of a lot of the other stuff that I was doing. I was doing a lot of rehab and good things if you look at it from the context of what we were taught in chiropractic college. But I wasn't getting the results that he kept telling me I should get. So I kept calling him up and saying, what am I doing wrong? What am I doing wrong? He'd say, well, what are you doing? I'd say, well, I'm doing this, and then I'm doing that. And he's like, well, why are you doing that? Well, because I felt like I should, right? So for a while, I tried sort of an amalgam of ABC with other things, and it didn't work. So in 2000, I just finally said, screw it, I'm going to go 100% ABC, and all of a sudden, patients started getting better and better and better. But every now and then, I'd hit a wall. I'd get a patient that I just wasn't getting right, or at the same time I was going through ABC treatments with me, and the guy that I was working with, I was driving 2 hours to go get adjusted, and I was doing that 3 days a week. We would hit a wall, so I would either call Jesse, or I'd go see Jesse, or I'd go to another seminar, and over a period of years, all of a sudden you feel like you're starting to get proficient at this. So one of the things I always tell the doctors or the practitioners that want to learn it is, it's a very easy system to learn. It's a tough one to master. It takes continuous work and self-critique and observation, and it's just a process. It's never ending. I've been doing it now for over 16 years, and I still get refined and fine-tuned when I meet with Dr. Jesse, and there's continuous improvement. I'll get presented with a case that has a completely different history from what I've ever had. The recent one that I've got now is a gal with ankylosing spondylitis, which we all learn is an inflammatory condition, not a lot to do. The spine just fuses up, and we've been doing a lot with her, and she's improving. So it's a condition you don't see a lot of improvement with in the rest of the practices. So that's really my ABC story. I talk to a lot of chiropractors in particular, and practitioners of all sorts, physical therapists, osteopaths, naturopaths. We were all taught a certain model, So the way I frame it for people is it's all about the paradigm that we were offered, right? So we spend thousands and thousands, hundreds of thousands of dollars in our education and our training and years of dedication, and we're learning everything there is to know about Newtonian physics, right? And Newtonian physics is accurate, but if you get to the fringes of that data set, things start to fall apart. There's questions we can't answer, right? Well, when we expand that data set to quantum theory, now all of a sudden we've got a much broader data set to operate with. That creates a whole different system. And so when I'm talking to practitioners, I tell them that's the type of change in paradigm and thinking that you're going to get with the ABC method. It's not just another technique. It's a completely different worldview of how the body works based on a new set of data and observations, okay? So it's not that, I think what practitioners have a hard time with is we're so invested in what we do, our practice, the amount of money we put into the tools and the treatment tables and all the, the fancy bells and whistles that we use, that we're emotionally and financially invested in that. My thing is, are you actually delivering on the results that you keep telling patients you're going to get? And if so, is it measurable, is it reproducible, is it consistent? Not in my experience. And I've had every technique applied to my body. I had a blown disc, I fractured my neck. I've got a history that, is one of those more difficult cases that would walk into an office. And I was getting chiropractic care, I was getting acupuncture, I'm trained in acupuncture and chiropractic, I was getting osteopathy, I was doing everything. And it kept me functional, but it never got me better. And what I mean by that is I had to stop rowing when I was 24. In 2006, I was rowing in the Masters Worlds again, but that was only because of ABC. And it was when I started doing advanced biostructural correction that my body literally started to repair and regenerate itself to a point where I could go back to do things that I had given up years earlier. So that's really the story I share with the practitioners is don't get hamstrung by your paradigm. It's just a model. And if you look at it objectively and ask yourself, am I getting measurable, reproducible, and consistent results? Now, what I find is a lot of new practitioners to ABC say, well, I'm not getting the results that you are saying you get or Dr. Jesse gets, so it must not work. I go, you're looking at it the wrong way. That's inaccurate. You're probably not applying it. And what I've found in my own experience is if you're not getting the results that Dr. Jutkowicz talks about, either the patient isn't following through on what they need to do or you're doing something wrong as a practitioner. And that's a tough one. You got to sort of be open to criticism and critique. And Dr. Jutkowicz doesn't, he doesn't mince words. He'll hit you in the running lights, and a lot of people get offended by that, or they get sensitive or thin-skinned. I'm like, look, he's doing it to make you the best practitioner there is, and suck it up. Be willing to be critiqued and to continue to learn. I think the difficulty for a lot of people, especially if they've practiced for a long period of time, is they've achieved a certain level of status and expertise, and they're comfortable with that. And it's always uncomfortable to go outside of our comfort zone. But if we don't go outside of our comfort zone, we don't continue to grow. And really, if you're going to be a master practitioner, you're a master student. You're always willing to grow and learn and expand. And that's what I would share with the practitioners out there that are interested in doing this. Yeah, the average person that doesn't know much about ABC, I run into them all the time. And what I do is I sit there and I say, look, I'm not going to have a conversation with you and try to convince you. I'm going to show you something. And I say, breathe in, breathe out, let your body go. Now tell me where you feel restriction or resistance to that breath. And they'll tell me. And then I do a first rib maneuver, same thing that Dr. Jutkowicz did with me the first time. And I say, breathe in, breathe out, let your body go. And I say, now, what did you notice? And they all invariably say, well, the tension that I had isn't there, or it's much less, or I can breathe a lot deeper, I feel like I'm standing straighter. And I go, right, that's just scratch and sniff to what I do. That's just the tip of the iceberg, but just that demonstration right there tells you that the whole model of stretching, strengthening, adjusting all this other stuff, really, it's not wrong, but it's incomplete, and we're the next degree, we're the next level And if you really want your body fixed, come see me.